question for you is, how do you approach immunosuppression, and do you think this paper should influence how we risk stratify these patients?
First of all, how I approach immunosuppression, I think I started off mostly like many people in identifying immunosuppression more as a binary variable. Either people were immunosuppressed or they weren't. I think it's becoming more and more obvious that there are varying degrees of immunosuppression with varying degrees of impact on cutaneous malignancy. So immunosuppression is associated with an increased risk of poor outcomes in cutaneous squamous cell carcinoma, but it has been suggested, as you mentioned, that it may not be an independent risk factor when tumor stage is controlled for.
Right.
This implies that the increased risk of immunosuppressed populations is largely mediated by the development of more aggressive or advanced tumors rather than immunosuppression itself being an independent prognostic factor. However, I think recent prospective and retrospective studies, including this one, provide compelling evidence that immunosuppression is an independent risk factor for poor outcomes in cutaneous squamous cell carcinoma, even when controlling for tumor-specific features. And we look at some of the guidelines that are out there. The National Comprehensive Cancer Network guidelines explicitly recognize immunosuppression as a high-risk prognostic feature in cutaneous squamous cell carcinoma and recommending its inclusion in risk stratification and management algorithms. So I think in summary, the current consensus in the medical literature and clinical guidelines is that immunosuppression independently predicts poor outcomes in cutaneous squamous cell carcinoma, and its omission from staging systems may actually underestimate risk in this patient population. So I do think this paper will influence how we risk stratify patients.